Have you ever considered the magnitude of cervical cancer's impact worldwide? It's a silent predator, ranking as the fourth most common cancer among women globally, with a staggering 660,000 new cases reported as recently as 2022. That same year, a heartbreaking 94% of the 350,000 fatalities were in low and middle-income countries. But what causes this devastating disease, and most importantly, how can we prevent it? The culprit is a common sexually transmitted infection known as human papillomavirus, or HPV. This virus can affect the skin, genital area, and throat, and nearly every sexually active individual will encounter it at some point in their lives. Though often symptomless, in most cases our immune system will clear HPV from our bodies. However, if HPV infection persists, it can cause abnormal cells to develop, and over time, these can transform into cancer. Specifically, a lingering HPV infection of the cervix, the lower part of the uterus or womb, can lead to 95% of cervical cancers if left untreated. In general, this process takes 15 to 20 years, but in women with weakened immune systems, such as those with untreated HIV, this timeline can shrink to a mere 5 to 10 years. Certain risk factors can hasten this progression, including the type of HPV, immune status, the presence of other sexually transmitted infections, number of births, young age at first pregnancy, hormonal contraceptive use, and smoking. Now, while these facts may seem grim, there's a silver lining. Prevention is not only possible, but highly effective. Public awareness, access to information, and services are our secret weapons in the fight against cervical cancer. One of the most effective preventative measures is vaccination. Administered between the ages of 9 and 14, the HPV vaccine can prevent HPV infection, cervical cancer, and other related cancers. Regular screening from the age of 30 or 25 for women living with HIV can also detect cervical disease early. When promptly treated, this can prevent the progression to cervical cancer. Early detection and quality treatment can cure cervical cancer, even in those who have already developed symptoms. As of 2023, there are 6 HPV vaccines available globally. These vaccines protect against the high-risk HPV types 16 and 18, responsible for most cervical cancers. They have been shown to be safe and effective in preventing HPV infection and cervical cancer. Ideally, all girls aged 9 to 14 should receive the vaccine before becoming sexually active. People with reduced immune systems should receive 2 or 3 doses. Other preventative measures include not smoking or quitting if you do, using condoms, and voluntary male circumcision. Women should also be screened for cervical cancer every 5 to 10 years, starting at age 30, or every 3 years starting at age 25 for those living with HIV. So there you have it. The reality of cervical cancer is daunting, but with knowledge comes power. The power to prevent, to screen, to treat, and most importantly, to beat this disease. Remember, getting vaccinated and screened for cervical cancer isn't just a personal choice, it's a step towards safeguarding our global community. So make your health a priority. Get vaccinated, get screened, and help turn the tide against cervical cancer.